So good evening, everybody, and welcome to the IACT IMDHA Hypno Expo Presenter Series for 2022. Tonight, we're going to begin by interviewing Patricia Scott and Eric Rosen about their medical hypnotherapy certification training. I think there's one more day in that, one more word in that I didn't say right. So I'll let you straighten out the title of your talk for me, for me and for our guests. And I would like to just begin by introducing Patricia Scott, who is a great friend of mine and has been for so long. So as Karen said in the pre-show here, I always rush off to get Patti to do the introduction because she is such a great friend of mine. She has been in hypnosis, gosh, for donkey's years, I think, a long, long time. She's came here. I first met her in California, by the way, at a lovely hypnosis convention that, gosh, what was the name of that organization? I'm sorry. Say it again, Patti.
ABH.
Of course, yeah, an ABH convention, and I don't even remember what year now, but a long time ago. I had just come to Florida about that time, and a couple of years later, I was so lucky that Patti came here herself, and she and I did a number of trainings and programs together at her place over there in Palm Harbor in hypnosis and NLP. But she's been teaching practitioners hypnosis and NLP for quite some while. And before she was a hypnotist, she has this wonderful, impressive history of 20 years in show business, and she brings the show. So we're really glad to have you with us, Patti, and welcome this evening.
Thank you. It's great to be here. Nice to see all these smiling faces. Oh, new people too.
Yeah.
We're all new.
Yeah.
And Patti's not in this on her own or alone. She has a partner. And I just want to say that this is one of the first people I ever met, Michael, at an IACT IMDHA conference, Dr. Eric Rosen. We had lunch together at that very first conference I think I ever attended with IACT IMDHA, and have enjoyed knowing him ever since. So there. And I met Patti too about the same time and love her just as much. So there's no competition here. Let me tell you about Dr. Rosen, though. Eric Rosen is a licensed psychologist in Florida and New York, a former associate professor with Argosy University and National Louis University. He holds a PhD in counseling psychology. He's an adjunct instructor with the Florida School of Professional Psychology at NLU Tampa, certified IACT IMDHA hypnotherapist, and master trainer of clinical hypnotherapy. He's the 2018 IACT Educator of the Year recipient, and he teaches hypnosis with FSPP and Up Hypnosis Institute. So Eric, welcome, and thank you very much for joining us. I don't think you and Patti had brought this thing completely together when you and I first met. This is sort of a kind of new in the last 4 or 5 years, isn't it, that the two of you came together? One of the reasons I ask, and Patti, I know you can appreciate this, people sometimes mistake Michael and me for husband and wife because we do the virtual chapter together, and we've had people say, your husband or your wife. You two are not married, right? Even though you live in the same city.
Not to each other.
Not to each other. So how did you bring this whole thing together?
Well, it started a long time ago, actually, and then once I met Eric, it took off like a rocket ship. So, and we've been working with since we got it approved through the International Medical and Dental Hypnotherapy Association a few years ago, and it's evolving. It's a living, breathing thing. It's changed every year. And I just wanted to correct one thing, Michael. It is a medical hypnotherapy specialty training for 2 days pre-conference on the 11th and 12th of May. Right. There is a certification available for people who want to continue, but that takes more hours, which we do online post-conference if anyone's interested. But it's a complete training in itself, just those 2 days, and they get a certificate of completion. So we've been working together now, Eric, how long? Gosh, 10 years or more, at least.
Yeah, over, yeah.
Yeah.
Okay.
And I have to agree, meeting Patti inspired me into all the talents that she brings to this. And what we've done is we've really fused the approaches that each of us have in understanding that in terms of clinical hypnotherapists and also people that may come into the field even with medical backgrounds, what we're finding is there is a great complementary, integrative hypnotherapy interest that people have, and it's even being touted in many of the medical centers where people are making use of it for a whole variety of different things that we actually cover in the course, and it becomes a wonderful premise for people to use in terms of working with their clients. It also helps to expand business, and it gives you the language to also reach out to other resources in the field, such as physicians and specialists, because they are looking for people that do what all of you do.
Great. So who is a good candidate for this course? Who are the people among us that who should take this class?
Well, the training is not meant for someone who hasn't had any hypnosis training whatsoever or knowledge. They don't necessarily have to be certified, but we don't do the basics of hypnosis in the training. So we take off assuming everyone in this training has had enough experience and training to be able to do the basics. From that point, just about anyone, we've had people, everyone from medical professionals in there. We've had people that are in the mental health field. We've had nurses, and also just people that want to learn more about hypnosis, which is how I got into it originally, because I was using it for myself early on in my career, actually before I even got into hypnosis. And so really anyone who's really interested in helping people, and definitely if they're going to be a hypnotherapist, if they're going to be a hypnotist, a practicing hypnotist, I think this takes it to the next level to make sure that they're very confident knowing that they can address medical and mental health issues with the right, training and scope of practice and the language of it. And the idea of integrative medicine, like Eric was saying, is the new normal now. Everyone wants to work in teams. I was just in doing some research recently again, MD Anderson, their whole site practically is about the team. And they talk about using medical hypnosis for so many things. It's so easy to find the research and the background and the support for it in the National Institutes of Health and Mayo Clinic and all of those places. So anybody who's interested in accelerating and enhancing their hypnosis practice, I think this is a great class for them. Right,
so
Eric?
Patti or Eric, what makes medical hypnotherapy different from other forms of hypnosis?
Well, I believe some of this has to do with understanding how it can be applied to help people to become active participants in their wellness. And so what we're doing is helping clinical hypnotherapists to understand that when people come in, they're not always coming in. It's interesting. Even as a licensed psychologist, I see people for all different interests and so forth. And people don't always come in with a particular interest to work on a medical issue. But once we start to interview and get to learn about people, what we discover is there's opportunities for hypnosis to be useful. And I call this, there are different targets for where hypnosis can help, from stress management to dealing with side effects from medications. Did you know the average American here actually is on about 4 to 6, I know, believe it, 4 to 6 medications, and over 60 up to 15 medications. Now that's a whole other topic about overuse of medications, but the idea that there are side effects with many of these different concerns, hypnosis becomes a powerful source and help for these folks. We also can make use of this to help people with, I call it and there was a famous book on it, the biology of belief, that how people feel about their medical issues, it's all between the ears. Whatever you're dealing with, it's the meaning that we assign to our medical issues. Mm-hmm. And so hypnosis, because it really gets to the core of how we believe about ourselves, our ID, if you will, that we can work that and help people to feel more empowered to deal with their medical issues, to motivate how they're going to manage self-care. And we're really taking all the essence, the kernels of what you may know already, and giving you a medium for it and a target to address and bring in more clients and help the ones that you have.
Nice. So I understand, by the way, that there's so you started to say this, in fact, already, Patty, if I can just bring it out a little further and get clear about it. So this is a specialty training, and they get a certificate of completion for attending the specialty training in medical hypnosis. And it can be expanded somehow to become an option. There's an optional certification element. How does that all work?
Yes, the 2-day training, obviously in 2 days, it's limited what we can, we move pretty fast and we go through as much as we can possibly get in those 2 days. And it is a very interactive class. So the 2-day training is meant to be a complete training for people who already know hypnosis, and they will get that certificate. If they want to get certified, it requires more hours and some outside assignments. So we have the certification post-conference, and we've been doing this the last few years, and actually most people end up taking it. We've had some great feedback on it. And this one is going to continue on June 4th and 5th is when and it's three more weekends spread out over a few weeks. And they're all done online. And then there's outside assignments and practicums that they do, and some different things that they have to do in addition to those 3 weekends. And to do the certification with my company, Up Hypnosis Institute, they also, if they're a member of IMDHA already, they can also get an additional certification in medical hypnotherapy as a medical hypnotherapy specialist for an additional fee. Now, if they're already a member, what I've been doing the last few years is my company covers that fee for people who are members when they start the training. They can get that anytime in the future. If they're not a member, that when they join, they could get that for an additional fee. But that requires at least 200 hours of previous hypnosis training. So that requires a little bit more intense training to get the certification. Does that clarify it for you?
I think so, but I'm wondering, a segment of this is something that they do online after the fact, or how is that just something from the COVID era that I'm not remembering?
No, we do, because people are from all over the world the last 3 years since we started doing this.
Sure.
So the additional hours after the first 2 days at the conference for those people is completely online.
Gotcha.
Yeah, I do some in-house training in Palm Harbor here for local people for some different things, but that's a whole different piece of it. But I get local people if they want to become part of this program too, but that's a different thing. Yeah.
But now they can take the 2-day training, not get the certification, but still be able to apply it in their practice, right?
Absolutely. It's meant to be immediate application. And I think what Eric and I most, because we're so enthusiastic about all this, and it's such an exciting field. Like I said, it's so dynamic. It's changing every year in so many ways, that the main thing we want to do is get people really excited, because when we're working, as all of you that are hypnotists know, when you're working with hypnotherapy with a client, even if it's a non-therapeutic type of a issue that you're working with, you're going to still be affecting all those other things. Like Eric said, a lot of people now are on medications. They have other things happening that may not be the focus of what we're working with them on. But it's nice to know that we can have some additional skills that we can introduce, and then we cover scope of practice, and you can expand on what you do with some of these clients, which might be beyond what they first think of using, a hypnotist for. And if they have some other issues that we can, with the medical referral, then we can address some of their medical issues directly. So it talks about how to expand your practice in those ways too. And again, working as, in concert with the medical professionals. And
How much medical knowledge do I need to take this class?
Eric, you want to jump on that?
Well, the good news and what Patti just said is that because you already have the fundamental tools, then it's not required that you have a medical degree, or that you understand anatomy, or that you know different processes. That's not required. It's really being able to take what you already know, and then we're going to help you learn how to apply it. And some of the applications are things that you may already do, and you haven't really considered that what you're doing is helping people with their medical issues. Again, it's a complementary integrative service where we don't compete with physicians and other people in the medical field. We're not saying that what we're doing is better, or that we can replace what they're doing conventionally. It's really integrating And it can be in ways, for example, self-care. It can be improving people's motivation, like somebody who is diabetic and has difficulty with managing their carbs and being able to check their blood sugar and maybe get a little more exercise in their walking. Oh my gosh, hypnosis can address those beautifully to help people motivate themselves, step into your better self. We do that. How many people have issues you discover with injections and needles and going through tests? How many people can feel very claustrophobic and closed in when they go in an MRI, and the sounds and the reverberations?
Yeah.
I mean, there are people that avoid so many medical treatments and tests because of fear and anxieties. Hypnosis is beautiful because it helps empower people to face things, and then it creates more wellness opportunities. So these are just a couple of the tidbits that you're going to learn. And imagine people discovering, and it happens all the time. People go, you do that? Can you do it for this? Well, what about that? And it's go, absolutely.
And I want to throw into Eric has one of the first things that he introduced into this training with, when he first came into it with me, was to talk about the diagnostic codes. Now, that's something that, of course, I'm not a trained medical professional, so that was foreign to me. And Dr. Rosen makes it so understandable. We do introduce people to Dr. Rosen does, to the diagnostic codes, the DSM, in a way that you can be familiar enough to know how to talk to the medical professionals and not be completely lost. Like you said, you don't have to know the biology and all the ins and outs of it, but to know enough about it so that you can speak intelligently. And I think part of our job too, as hypnotherapists, now that we are gaining so much credibility with all of the medical professionals, is that we can help to educate our local community medical professionals, mental health and medical professionals, that we can help introduce them to all of the wonderful things that a medical hypnotherapist can bring to that team, that frankly, nobody else has generally the extensive training that we do in doing hypnotherapy. So we have something very unique that we can bring to that team. And it is so gratifying. That's the thing that's really exciting about this field, is it's dynamic and it's gratifying. And when you can help someone feel better, oh my goodness. And plus it helps you help yourself as well. Some
Pat,
people take it just for helping themselves,
Yeah, I'm so glad to hear you saying that, because one of the things that I have found among hypnotists sometimes, and I think, and so wrongly, because it's the opposite of my experience, at least, but there are a whole lot of hypnotists who have the idea, I don't know, and I really don't know where they got it from, other than from each other, maybe some cultural myth that we have in the hypnosis community that says, well, they're not going to take us seriously because, they went to medical school and they wear white coats and, and they don't think that we know what we're doing. And I'm like, it's never been my experience. My first client in Orlando was a surgeon who was having panic attacks in the operating room. And I'll tell you what, it was a wonderful thing for me to work with him, because the almost immediate response was I started getting referrals after referrals after referrals, not only from him, but from people that he talked to about my work and like that. So my finding is that yes, this is a good idea. Not only that, when people question, hey, you've got to have a referral or you got, and all that stuff, I'm like, look, if I've got a client who has a medical condition, I would like to be a part, as you have rightly said, part of a team with their physician. And so I just love the way you're talking about it. That's great to know. And as I heard you saying then, so do you help people then know to learn how to talk to doctors so that they can get referrals and such as that, right?
Right. That's part of the training is how to be part of that team, to take away that intimidation factor, like you said, that some hypnotists have of working with medical issues. We are so unique. And as soon as they finish this training, the comments that I've heard the most through the last few years from all the people that have taken it is they're really confident now that they can actually work with these kinds of things. They don't have to go to medical school and learn that side of it. That's not, what our job is. And in the same way, the medical people can appreciate that we can spend a lot of time with their patients. We have a whole nother slate of skills and talents that we bring to it that they can appreciate. So if we're proud of what we do, and we talk about different research that's available, and that's getting more and more every year, of course. So we give the students the tools to start to really be able to be confident and know that, you know what, I'm competent at doing this. And here's some research and some ways that I can help the medical team to be more effective with the patients they're working with.
Yeah. And in fact, as I think about it, the times that I've heard people say, well, I don't know if doctors will take me seriously. What I was really clear about from the person that was saying that to me was that they didn't have that confidence in their own, in their own ability. And I know if somebody comes to me and says, well, I took this class in hypnosis and I think maybe, I could do something useful. Will you let me work with your patients? I'd probably say no, but when we recognize as hypnotherapists that we are specialists, you're absolutely right about that. In a very thin slice, here is the area of our specialization, and we really can use it to contribute to your practice. Then I think that's going to work out a lot better.
I'll bet your students will walk away with some ideas of how they can even train doctors or medical professionals on how to use some of this stuff with their own patients. I mean, that could be another way to go with this, isn't it? To have some kind of group work that you work with doctors or nurses or first responders or something and teach them some things that they can use in their own business. I'm guessing.
Eric,
I'm sorry.
It's interesting. When I work with folks, I tend to get a consent, and then with that, then I'll reach out to their primary care doctors. You have to. We teach some of this model and how to network, and you have to think of primary care doctors as like air traffic controllers. So they sort of watch all the planes and make sure that the planes are landing where they need to. So I got a hold of a primary care doctor, and they connected me with a neurologist, with someone that I was working with. And when I connected with the neurologist and I mentioned some of how the clinical hypnotherapy could help, it's like they were not only interested in more cards, they also said, when is the next class that Patti is doing? So there are people out there that they're starving for other means to help people. I mean, definitely the conventional means, but this is very integrative with everything that people are doing. The thing that we do stress, and we stress all the different techniques that that we use, and we apply it to different medical domains, to different medical problems, is that we're emphasizing scope of practice and how to communicate with other providers.
Yep.
Patti, yeah, Karen and I are looking.
Stretch.
No, we're not. Nobody's wanting to step on anybody else. Go ahead, Michael.
Yeah, the other thing is partner. Yeah, like Eric, just to take off on what he was saying, partnering. Giving people ideas about how you can partner with the medical community. There's all kinds of new fields popping up here and there. Everybody's taking a piece of things. What I'm noticing is people are taking what I learned in hypnosis the last 30 years, and actually 20 years before that I was studying it, and they're creating new fields. They're coming up with things like positive psychology and mindfulness and these things. And when you read what they're doing, it sounds like a hypnosis session. And now they've got hypnosedation is the new buzzword that I really liked it when I heard that, because we've been saying hypnotic anesthesiology for many years, and it's kind of long and hard to spell. So hypnosedation is something that the medical profession is starting to know. I saw it on the Mayo Clinic's website earlier today when I was doing some research. And see, we can talk in these terms. We can talk about mirror neurons. We can talk about psychoneuroimmunology. And even the general public is starting to be aware and hear these words. And when we present them in the context of what we are able to help people do, and again, knowing that it's within that person, that's why I love this field so much, because the one big difference between us and I think most everybody else out there doing therapeutic work is that we are guiding the person and they get all the credit. hopefully, if you're doing it the way I teach anyway, that the person realizes, oh my gosh, you just got me to realize I have the power to do something. And it's just so exciting. I can't imagine anybody not benefiting from, and again, this is 2 days, but it'll catapult people hopefully to want to learn more. I'm a lifetime student, and people that love doing this, I'm sure, are the same. And I learned from Eric. Eric learns from me. I learn from my students. This, like I said, this class has gotten more interesting every year, and we're going to keep building on it.
Well,
In case we didn't make it clear, it is Wednesday and Thursday prior to the conference, a pre-conference. So you've got to register ahead of time for this. Michael, it's all you.
Well, first of all, I tell you one of the things that I think is really cool about this, and you got to forgive me for joking, but it's just who I am. I think if I were to take your course, I know that my Scrabble game would improve remarkably, with lots of very valuable words. But also, I'm wondering, you've done this for a few years now, and for several years now, and and you've had students that have taken your course and incorporated into their practice. I'm wondering, and I know I'm putting you on the spot with this because it wasn't a question that you gave us to talk about, but I'm just wondering what kind of reports you get back from former students in terms of what a difference this is making for them in their hypnosis practice.
A lot. Actually, I've done some interviews with former students, and from all over the world, literally. And it's been surprising to me because these are people generally, well, so far they've all been people that didn't go through their original hypnosis training with me. And I've just been amazed at how excited they are about things that I guess I kind of just took for granted that I was learning through the years and that I was introduced to. And we introduce people to some things that just really get them excited. And I guess the best evidence of that is that a lot of them are coming back and taking some of my other trainings now, and they're actually taking this training over and over again, because they can do it, and it's like I said, an evolving class, so they can take it again very inexpensively in the future if they want, and get all the new stuff all over again. But I do want to emphasize the 2 days is meant to be on its own training. You're gonna have a really good start to starting to interact with medical professionals and feel confident about working with these things. So just want to make that real clear. It's really designed to be a training in and of itself.
Now, something that helps me decide about programs like this when I see them in the catalog, in fact, it's kind of interesting. I just noticed when I see them in the catalog is that I tend to visualize. I tend to imagine what's it going to be like for me to be in that class. Do I want to spend 2 days there with those people, and what are they going to be doing? Because sometimes it's it's just a long, slow recitation of data from the front of the room. Sometimes it's exercises and interaction, and there are all kind of ways that people put programs together. What will your 2 days look like if I were to drop in the middle of the day?
Well, it's all of the above. And again, on YouTube, we've got some excerpts from some of the past trainings that we've had permission to put out there. And Eric, you want to jump in there?
It's probably a blend. Anytime you go to a workshop, we don't want to hypnotize people into so that's not our purpose. In fact, it's interactive, it's didactic. People get a chance to practice the skills. And when you were mentioning before about confidence, I remember one of the last ones where Patti had a beautiful script that actually helped everybody with building their confidence to make use of all these different techniques. And that was done as we were launching them from the end of the workshop. So and it's fun. I mean, people get to interact. There's also opportunity to, because it's talking about medical issues. Again, we in no way are expecting people to expose their own medical issues, but people sometimes will talk about, I had this situation and this happened. And it's like, and then they get to bring in, what did they find useful because we all know that when we're in a field, we make use of it ourselves. And the fact that you can take some of these and even use it and benefit means that you're going to bring all that knowledge into helping other people.
Nice.
So will there be practice in your class? Will people learn brand new techniques and then they'll practice them on each other, or brand new ways to dialogue on something and then break off into groups? Is that the kind of thing that might happen?
There will be new things, some of them that I didn't even think were new, that a lot of people weren't even familiar with, and again, the concepts and the principles are kind of the same across the board for a lot of different techniques. We go into, in the extended training, we get into kind of an analysis of why do you do certain things within a hypnotic process? What is the approach? What is the purpose behind some of the things that we're doing? And definitely listening skills. That's a big one I'm noting through the years, is getting people to understand, to listen to the client, because that's where all the good stuff comes from. And that's where you can really get the clues. And like Eric said, the things to target, I call it subtext, the meaning behind the words. And we have little things we do with how to really listen for their belief systems, their values, which can be their motivators, and some of those kind of things too. So I think it's more of a training to prepare someone, like I said, to walk out of the training being excited and confident and really wanting to learn more and practice more and really do more with the skills that they already have, that they brought to it.
Something that I like, and I heard you say earlier, and I don't think over the last couple of years I've actually heard this or really gotten it, but apparently it's true, and it's what you do. Eric mentioned was talking more about self-care than I had heard before, and I think, oh, what a wonderful thing, and part of that, if I understood him right, Eric, if I understood you right, was something about working with people's beliefs about how their health is. Last week when we were on here, I mentioned a study, and if you'll indulge me in just sort of highlighting it again, a study out of the University of Wisconsin, where they with regard to stress, which is something that I've been working on a lot lately, and doing the stress management program. And what they discovered was, of the people that reported high amounts of stress, they had 30,000 people they interviewed. And they asked them, how much stress are you experiencing, or have you experienced in the last year? And they asked them, do you believe that stress is harmful for you? 8 years later, when they checked the death records, they discovered that the people who had high amounts of stress in their life were 43% more likely to have died of strokes and heart attacks and a variety of illnesses and conditions, but that 43% was all contained within the people who had said that they believed that stress was harmful for them. And of the people who didn't believe that stress was harmful, that didn't have that belief about it, even the ones with high stress didn't show any significant difference from the norm, and not even as much as those people who had only reported a little bit of stress, but a belief that stress is harmful. So I have this real appreciation for the fact that what our clients are thinking about their experience is making such an incredible difference. And this is the kind of thing that doctors don't deal with in their office. What makes you just right for an audience of people, right?
Well, I think you're bringing a marvelous point, in that how people think and what they believe about their illness also has some subtext. For example, sometimes I work with people and there can be a loss of motivation to do the self-care, to take care of whether it's their blood sugar, their exercise, their watching their salt, a whole host of different things that we sometimes would choose to just go like this and eat that big, juicy, gorgeous cheeseburger. But the issue with it is that it comes out of, and we teach this, again, not to the point of being overly didactic, but to help you understand, it comes out of the field of health psychology, that actually the beliefs that we have about our body and our illnesses is really what is behind the motivation to take care of ourselves. I'll give you a quick example. I worked with a woman who had a whole host of different medical issues. And what was underneath in the subtext was a lot of shame, a lot of self-blame, that this was like punishment, that all these medical issues was confirmation that she deserved to be punished. And so the hypnosis is beautiful to help release some of those those cognitive beliefs that are really distorting the ability to take care of yourself. And that's the beauty of hypnosis, because we go right to the core of core beliefs when we're making use of hypnosis. And we can do it in targeted ways through metaphors, through stories, Ericksonian work, the parts therapy, all these different techniques that we have that help us to be able to reframe. And I call it your mental wallpaper. It's kind of like if you have a room and you walk into a room and you see this wallpaper and it's full of rainbows and unicorns, and you go, I really love this room. Now, what happens if the inside of your mind has all these dark clouds and lightning and rain and just horrific things? You go, I don't like sitting in this room at all. I think hypnosis changes your wallpaper.
Nice. And I really like that, by the way. And as an NLP person, I'd have to tell you, I tend to be more auditorily oriented. So when you're talking about changing wallpaper, I think that's interesting. And yet the metaphor that I hold is having different background music, and that. So yeah, that's great stuff. I really appreciate that.
And to pick up on the auditory part, it's what we're telling ourselves.
Yeah.
So it's not just the images, it's also that other modality of the words we use in the background. In other words, if we believe that the reason we have a medical issue and it's not working and it's not getting better is because, I really deserve this.
Yeah.
And that is in the thinking. And so what we're doing is changing it.
I really deserve this. And in my family, people of my age tend to develop this condition, or all of those other voices in our head that we've got.
And that's where the listening comes in too, because that idea that actually it was in a class that we were teaching together, that I was teaching with Eric and writing on the whiteboard, that it kind of popped out. We were talking about belief systems, and that we listen for, who do they think they are? People say, I am this person, or I in certain situations, here's just what I do. I've always been this way, that kind of thing. And they reinforce it with their internal dialogue. That identity gets reinforced through their internal dialogue. And I started doing this loop, and that reinforces, their filters and reinforces the belief system about who they believe they are. And we realized, that identity, that ID, who they think they are, formulates their internal dialogue. And I always say, whatever they're saying in their head is going to come out of their mouth to the hypnotist. And that's what we want to listen for, is who are they telling us they are, and what do they believe is possible or isn't possible, or all those things. And that kind of gives us starting points for what we know to help them with, or to get past or over or through or whatever, or get rid of or get more of in some cases.
I hear you saying, Patti, that you're going to be training very individualized work with each client, because there's no one size fits all. But I'm guessing that you'll also have some scripts and other things that will augment the training for jumping off points. As much as, I don't like to use scripts. We all start from someplace, and a script isn't a bad place to start to learn something from. So you're
Absolutely
passing that, right?
The scripts I think of scripts as a learning tool. They helped me a lot when I first started, because, us hypnotists, we don't talk like other people. Hopefully, we're talking to the person's unconscious mind. That's where we have that skill level of knowing how to get to the other part of the inner mind and get the message with the right language. And we know all about that. We learn that hopefully in our basic hypnosis training, but for medical issues, it's even if possible, more important, because, words are so impactful to the central nervous system and to every experience the person is having. So, we definitely work with some scripting. We, in the extended training, we actually work with script writing. I believe, again, that's a good tool. Studying, analyzing scripts, writing scripts, those are good creative endeavors. And then when you get in front of the client, your mind has more available, and then it gets created on the spot. That, that's the real magic happens in the moment. And that's part of the training too, is how do you connect with that person? And now you've done all the training, so, just trust it. And that's where that confidence comes in. Now I know what I know. And what's important is the other side of the communication and listening and feeding back what's going to be helpful to get them where they're wanting to be. help them with that. So yeah, it's
And-
exciting
and-
stuff.
One of the things that we also, in covering, again, it's not a course that helps you diagnose, but we will talk about different medical conditions and disorders. And some of the threads can be, what are some of the beliefs that people may hold in having some of their medical conditions. And I'll just read a couple to tease you with. It's looking at different core beliefs about brokenness, loss of safety, security, not feeling lovable, unworthiness, a feeling of self-blame. And this comes out of the self-talk and also the interviewing. And that helps us then to target our scripting on those deficiencies, because that's what is preserving the obstacles to taking care of themselves.
Great. Listen, I'm afraid we've only got a couple of minutes left. So there's a couple of things I need to say. First of all, for everyone, this is going to be reposted, by the way, tomorrow. I didn't mention it earlier, but around about noon or so on the IACT IMDHA website. It'll be on the virtual chapter Facebook page, and it'll be on virtual chapter YouTube channel as well. So there are a number of places where people will be able to see it, and most of our viewers, tend to see it after the fact. So that's what will be happening. I also want to just apologize generally to tell you that without realizing it, a large portion of this program was with Karen Hand pinned to the screen when we were first talking, and I realized that I was watching you guys in this little bitty box for a while. So finally, they did get to see your charming faces. I know that they'll get to hear everything that you have to say, and I just want to own that before it gets out in the public. So I'm the
I
one.
just have to say that eye that's on Karen's, that's got me hypnotized right there.
Well, I only hope I wasn't doing
Placement
anything.
of that eye. That's all I'm going to say.
So while
My eyes are up here. My eyes are.
The big one's down there.
So while we've got a couple more minutes left, though, before we finish, and now that I've done my confessions and you've been fascinated by Karen's had her
Hi.
eye on you the whole time, and the whole audience, I just wonder, we might entertain a couple questions if you'll hang out with us for just a few more minutes. Our next guest is not arrived yet, as far as
Oh, Rob is here. Rob is here.
Oh, is he here? Oh, great. Yes, he is. I'm sorry, I didn't see him. So that's good to know. So I will point out that Sherry Berkowitz, while we were going along, did post something in the chat room, and she says she's been in school at I think it's the Southwest Institute of Hypnotic Arts, something like that, SWIHA, since October. And one thing that she has realized is that teaming up with both a psychologist and an acupuncturist is a winning ticket to give the client a much greater chance for success. And she said that when we were talking about teams earlier. So I just want to reiterate it and say that's a beautiful thing about what you do, helping hypnotherapists get connected to the medical community in a way that is productive for everybody and can really support a growing practice.
Absolutely. And it can be a great practice building for somebody even new to the field, because if you team up, when I first came to Florida, I teamed up with an acupuncturist and another office I had with a chiropractor. I'm working with a chiropractor now. These are all people that you can work with and have cross referrals and enhance each other's practices. It's a great way to work. Plus you learn more.
Absolutely.
Big on learning.
All right. Well, ladies and gentlemen, Patti Scott, Eric Rosen, May 11th and 12th. That's Wednesday and Thursday before the conference weekend. Medical hypnotherapy, a 2-day course, specialty course. And there's an option, again, with some additional time and arrangements that you can make with them to get certification as well in medical hypnotherapy. So wonderful thing. I wish you guys all the best with it, and we'll look forward to seeing you right here in beautiful Orlando, the land of the magic, for the Hypno Expo 2022.
Thank you so much.
Thank you so much.
Thank you. Hi, Jen.
Thank you.